Hello and welcome to our Health ABCs video on glaucoma. Today I will be discussing what glaucoma is, what symptoms a patient can develop if they have glaucoma, some of the risk factors involved, what treatment options are available, and lastly, there are some links that you can go to learn more about glaucoma. But before we get going, I want to inform you that this talk is created by a medical student solely for the purpose of patient education and is not to be used as medical advice and does not replace seeing your doctor. If you think you have glaucoma, schedule an appointment with an ophthalmologist near you. In order to understand glaucoma, we need to know just a little bit about the eye. In order to see, light from our surrounding environment passes through our eye and is focused on a part of the back of our eye. This image is then transmitted from our eye to our brain using a very special nerve called the optic nerve. This nerve allows our brain to receive the images around us, giving us the gift of sight. Glaucoma is death of this optic nerve. If I were to provide an analogy, I would think of the optic nerve as a train track, and the image from the outside world as the train traveling from one point, our eye, to a second point, our brain. In this example, glaucoma would be like resting of the train track, and it wouldn't allow the image or train to get from one point to the next. So, glaucoma is really interesting. In fact, we don't actually know what causes it. However, we do know that it's directly correlated with the pressure inside the eye. So, that's what doctors focus on because that's what they can control. This increased pressure in the eye gets transmitted to increased pressure in the optic nerve, which leads to its death. Glaucoma, or as we just learned, death of the optic nerve, can actually be split up into two subtypes, open-angle and closed-angle glaucoma, which I'll explain in just a minute. To help us understand this, I think it's important to ask why we would get an elevated pressure inside our eye. The inside of our eye is filled with a bunch of fluid, which is usually drained just like a sink. Usually, the water is flowing out of the faucet and the drain works perfectly, so there's no buildup of fluid. In open-angle glaucoma, the drain gets clogged, and the fluid backs up in the sink. Since our eyeball is an enclosed space, it can't overflow, so that increased fluid leads to an increased pressure in the eye, and that increased pressure is what kills the optic nerve. In angle closure glaucoma, the drain works just fine, but there's actually a stopper in front of the drain. That's not allowing the sink to empty properly. This leads to the same buildup of pressure and kills the optic nerve again. So what's it like to have glaucoma? These two different types of glaucoma have totally different symptoms. Open-angle glaucoma patients almost never experience symptoms at all, and it's usually uncovered by going to regular eye visits with your ophthalmologist. However, sometimes patients can experience a loss of their peripheral vision followed by a loss of their central vision, like shown in this top picture. In closed-angle glaucoma, the example of the stopper in the sink, it's actually an ophthalmologic emergency. It happens very suddenly and can present with symptoms such as decreased vision, halos around lights, headaches, severe eye pain, nausea, and vomiting. Usually the eye gets really red and swollen like in this bottom picture, and it's important to go to the emergency room right away if you suspect this. Here are a couple of risk factors that can lead to patients being more likely to develop open and closed-angle glaucoma. The incidence of open-angle glaucoma doubles after the age of 55 and quadruples after the age of 80. If someone in your family has a history of open-angle glaucoma, then you're more likely to get it as well. So regular visits with an ophthalmologist are important. As we've discussed previously, an increase in your eye pressure is a well-known risk factor and can be controlled with medications as well as a diet low in sodium and high in fruits and veggies. Risk factors for closed-angle glaucoma have a couple of similarities and a couple of differences. Family history and age are again risk factors, particularly in patients over 60. Closed-angle glaucoma is seen more frequently in females as well as in patients that are farsighted. Unfortunately, there's nothing we can do about any of these other than routinely see our ophthalmologist to see if we're at risk. As discussed previously, management is focused on decreasing the pressure in the eye. Treatment is usually with eye drops called prostaglandins and beta blockers that allow for the drain in the eye to work properly and decrease the flow of the fluid in the eye. Additionally, a laser can be used to unclog the eye. The laser is typically painless and is quickly becoming the first-line treatment option. Which treatment used is decided after a visit in conversation with your ophthalmologist. For closed-angle glaucoma, treatment is very similar. Ophthalmologists use the same eye drops as well as IV medications that are used to decrease the flow of the fluid in the eye, called acetazolamide and mannitol. After the acute attack is under control, the ophthalmologist will go in with the laser to make it less likely that the stopper covers the drain. I hope you found this video helpful, and if you want to learn more about glaucoma, feel free to check out any of the sites listed here. I appreciate you watching this video, and check out our other Health ABCs videos if you want to learn more.